Jean, you're there?
Thank you. Can you hear me all right?
Yes, please. Go ahead.
Great. I'm so privileged to be a part of this conversation and have been so impressed with the quality of the presentations in the last 2 days. Certainly the kickoff with Dr. Dietz and Heidel yesterday were very informative. Next slide. Can you advance the slide, please? There we go, thank you. Just as background, the American Congress of Obstetricians and Gynecologists is the nation's leading group of physicians that provides health care for women. I'm here to represent about 57,000 members and the women that we serve. We are looking for quality health care, clinical practice guidelines, and certainly our role in advocacy across the United States. And that's a very important role because we're both educating the physicians and advocating on policy changes. And this afternoon with this discussion on policy, the timing is absolutely perfect. Next slide. As OB-GYNs, we look at ourselves as primary care providers. We provide preventive health services, and most importantly in terms of this conference, we're seeing women before, between, and beyond pregnancy. So we're having that opportunity for preconception care and pregnancy, and certainly the window of human development that we've all been discussing is what is the impact of both preconception and prenatal care on truly the investment of future generations. We need to view pregnancy as an investment in our next generation. Next slide. I know we heard yesterday, but just to reiterate, we've had research that shows, as one person put it, a fetus is in some respects pre-polluted. We've got exposure to harmful environmental chemicals that are ubiquitous. And when Dr. Woodruff and her team did research, 43 chemicals were found in virtually every pregnant woman in the United States. We don't know what the ramifications of those are, but certainly in terms of the research that we've been having here, it's serious. And we know, next slide, that the research has shown that environmental chemicals can cross the placenta. When we look at the chemicals that are being ingested, that are being absorbed across a woman's fingertips, across her body, exposure to mercury during pregnancy, for instance, is known to impact cognitive development. And we heard yesterday about the research on DES, very clear research on DES having even a transgenerational impact. So we know that exposure during pregnancy are serious. Next slide. In 2013, ACOG and the Society for Reproductive Medicine came out with the first committee opinion on reproductive health and the environment. And that's absolutely critical. 2013 was a watershed year for us because as an organization, when we come out with a committee opinion, it is meant to educate all of our fellows. It was based on the research, and we said that all exposures are not created equal. The opinion came through our Committee on Underserved Women and looked at the particular susceptibility of underserved women. Next slide. Women of reproductive age have the potential in certain occupational exposures to be exposed to toxic chemicals, and they're very vulnerable to reproductive health outcomes. Next slide. And the most important thing for OB-GYNs is to appreciate that unlike pharmaceuticals, chemicals enter the marketplace without the detailed research on reproductive toxicities. We don't know much about them. We've seen certainly chemical exposures over the last year or two where a great deal was made in the public, and we did not have information out there. Next slide. What we've said to OB-GYNs across the United States is that you don't have to be an expert in environmental health, but you should be able to do an intake and inform women about what their potential exposures are. A great resource is Food Matters from UC San Francisco. Next slide. Our greatest message is that toxic exposures rely on the greater good. We only saw changes in lead levels when there was national policy. So as an organization, I said ACOG was involved in education and advocacy and policy. Once we have a committee opinion, once we've created those statements, then we can advocate at the national and at the state level, which is what we've done. We've got national policy statements taking place right this legislative year in Hawaii and in California, and certainly involving toxic reform at the national level. Next slide. We've identified policy gaps, and certainly Dr. Birnbaum's work has been very informative, very helpful for ACOG statements in the way that medicine are delivered and the impact on our endocrine system. That information is very critical for us in identifying the susceptibilities. Next slide. This next slide let's go on to the next slide. Yeah, the policy gaps. This one is the one that we've tried to emphasize most clearly to physicians, because as OB-GYNs, our world lies in the clinical evaluation, where we're very aware of double-blinded case-controlled research and new pharmaceutical development, and many levels of research before chemicals are introduced into the marketplace in the form of new medications. We are not at all familiar with the environmental world, where chemicals are released to the environment and then we're told to go ahead and study it. So that difference is really critical in explaining and educating to physicians, because they rely and quite often will say there's no research to tell us on how to guide people about environmental exposures, because it's not good research. They simply don't understand how different it is between chemical and environmental exposures here, and that the burden of proof needs to shift. Next slide. Our recommendations as an organization are, first, at the individual level, the physician should be educating women to be aware, eating healthy, washing fresh fruits and vegetables, looking at what their exposures are. But our greatest recommendation is that Congress needs to truly enact meaningful preventive and protective chemicals, so that the burden of proof moves away from the individual, away from the physician, and onto the chemical industry. We need to identify and reduce exposures to toxic environmental chemicals, and we need to strengthen both the EPA and federal agencies and fund the research that we've heard over the last couple of days. Next slide. We've heard from members that voters are concerned about chemical exposures. We've heard that 90% of voters support legislation that ensures that products are safe for human use. And we've certainly heard from our members that both demographic and partisan lines need to be involved in this. I have to say that it's been a very frustrating year with Congress. Even when we went to have our first presentation of this committee opinion, it happened the day that the Congress shut down. So we've been stymied in many of our attempts. Next slide. But what ACOG and ASRM have both said is that individuals alone can do very little about exposure to harmful environmental toxic agents, and it is the voice of healthcare professionals in the policy arena that is absolutely the most critical step that we have to look forward to, and that is incumbent on each and every one of us to take that voice and help these voices be heard. Thank you very much.
Thank you, Dr. Conry.